Good afternoon, everyone. Welcome to this segment of the Journey to the Healthcare Cloud. My name is Francis. Actually, I'm from Integrated Health. For this next couple of minutes, what I intend to do is actually share with all of you how we actually create the journey to the HCloud, or we call it the Health Cloud. I suppose quite a number of you could have already heard about HCloud over the press, what are we going to do, and so on and so forth. This segment of presentation will give a quick glimpse on how we actually transform the hospital systems, which is currently in the disparate data centers, into the cloud, and how do we move them over, and actually what are the actually benefit of moving them over. Okay, my agenda of this presentation is I will talk a little bit about my organization, IHIS, and then I will give a little bit background information to the Singapore healthcare landscape. For those who are not familiar, this will be a good glimpse of what actually today healthcare is all about, and then what do they do, and how does IT support the healthcare landscape. We'll talk a little bit about public healthcare data centers, and then I'll move on into the HCloud per se. What does HCloud provide, and how do we provide them? And then finally the journey, and we close off with some Q&A then. Okay, a little quick glimpse of what IHIS, where IHIS is. Today, IHIS is actually a company that provides dedicated healthcare services, IT services to healthcare corporations. The healthcare corporation we are talking about is actually public healthcare. We are not actually serving the private healthcare. We are actually 100% dominating in the public healthcare. So when you go visit the hospitals, we are actually providing IT services there. And we are actually 100% owned by MOH Holding, or MOH Holding, and obviously MOH Holding belongs to MOH. So that's how the landscape IHIS was formed. And when IHIS was formed, we took over all the IT professionals from the cluster. Previously, the IT cluster have their own IT professional, but when IHIS was formed, the IT professional from all the cluster aggregate into IHIS. And at that point in time, we are about 500 people strength of IT people in 2008 when IHIS was formed. Moving forward, today we are in the 5th years of operations. We grew to about 1,000 plus people. So you can see that within the span of 5 years, actually IHIS actually doubled itself, primarily because healthcare in Singapore is actually in a growing arena. If you're aware of the today healthcare landscape, the hospital are expanding, the patient load are also expanding, and so is healthcare. So today, IHIS is actually located at Serangoon North as a HQ, and today we actually serve 6 clusters. All the public clusters are actually served by IHIS, and we also serve 1 agency. Right, that is actually the arena of where we are right now. A little bit quick glimpse on what do we do. As a company, we have a vision and also we have a mission. As a vision, we actually wanted to be the trusted technology partner in the healthcare space, and we always want to lead and deliver technology in excellent healthcare. Obviously, you can see from the group, everything we do is about building IT capabilities within the healthcare arena. This picture give a good summary of where IT is in the delivery of healthcare. In today's context, if you do visit the healthcare institutions and you unfortunately have a chance to use the system, you'll find that everything that the doctor functions to you is actually very IT embedded. Right in the heart of the centers, when we deliver IT systems, we always have patient-centric service in mind, and we always wanted to integrate the medical processes into our IT systems so that we always achieve a very desirable clinical outcome. And we always take into consideration patient safety. So today, all the IT system is actually centering around these 4 or 5 objectives, where we wanted to deliver the care delivery with IT embedded so that we always can achieve patient safety, and we always wanted the patient who are in the hospital or getting a treatment in the hospital a very pleasant experience in the healthcare arena. So with that objective in mind, we always build our IT system with this set of objectives in mind so that the hospital can operate in the most efficient and effective manner. A quick glimpse of today how Singapore Hospice is about. We have community hospitals, we have nursing home, we have hospice care, we have also day rehabilitation centers. If you really count them, you can see that all in all, in Singapore, we have about 22,000 beds, but at this point in time, we are still running some big crunch, as you are aware of the hospital environment. We have actually 31 hospitals, and every 100 citizens, every 1,000 citizens, we actually allocated 2.2 beds to the citizens, and we have 78% of the beds are in the public hospital, and 81% of the beds are in Class C, and so on and so forth. And the average length of stay for any patient who actually awarded is around 5.8 days. And as all of you are aware, that today all the hospitals are having a very high occupancy rate of actually 80% occupied. So chances are, if you are unfortunately warded in or warded in, likely that you have to wait for a while before you actually get treatment and get a bed. So in today's landscape, healthcare is definitely expanding. We are building more beds, we are building more hospitals. At the same time, we are actually also building up more IT capabilities in order to meet the demand for the hospitals. So that's good glimpse. But if you can't actually visualize this, I hope this picture can help you to visualize. If you do walk within Singapore arena, within 15 minutes of journey, you should be able to get a healthcare institution coming to your need. So that's actually explain how deeply densely is actually IT hospital or healthcare institution in Singapore. We have actually the best infrastructure, we're actually the best hospital in this region of Singapore. Supporting all this infrastructure is actually IHIS, and today we actually supported 9 hospitals, 8 specialist centers, and 10 polyclinics. And all in all, there are about 37,000 healthcare providers that provide healthcare services to the citizens of Singapore. And behind the professionals are all the IT services and IT support provided by IHIS to actually render the service to the patient. Okay, these are the challenges that in today we are all healthcare institutions facing. Rapidly rising costs, highly variable clinical qualities, patient safety and confidentiality issue. We have the PDPA right now coming into the landscape. And every doctor, when they practice medicine, when they deliver care service, they have to be very careful with all these PDPA issues. And obviously, there's need to do evidence-based decision, complex administrative processing. And at the very, very onset of it, our consumer or our patient are getting smarter and smarter, and their expectation of healthcare is also higher. Now, all these active variables put pressure into the care delivery system, and therefore also put pressure on IT system. And the old traditional method of delivering services is therefore no longer sustainable, and we need a new traditional way of doing things. The new method and process that we're talking about is actually how to provide healthcare in a more effective, in a more more economical way. And the way we actually do is actually we start off by actually doing some form of data center consolidation to make sure that the IT processing becomes very efficient, very cost effective. We actually start off with some form of data consolidation within the healthcare data centers. We start off by having some form of consolidations. We actually then virtualize them and then we automate them. That is actually a very 2 or 3 years ago, or in fact 4 years ago, we started off this journey. But you find that the efficiency to all this journey tends to be very, very slow. Because how much can you make efficient in data center? It's only within the data centers. You can automate the process, but you cannot automate the whole hospital process. Okay? We actually went through this phase, and then you find that yes, you can automate and you can get efficiency, but that is a limit to the efficiency you get per data center. So what we then actually do is we take a look at all the data center today in the hospital and we start to do a consolidation. That's where we actually start the concept of HCloud or Health Cloud. With HCloud, we actually tend to bring all the data center into a big data center, and instead of running one big data center, actually we run 2 big data centers, and we actually link to them through high-speed link and make both data center highly active, highly automated. And with that concept, we are able to move system from one hospital to another in a very rapid manner. Right? With today's virtualization technology, with today's technology, actually we can actually do that. And that is actually how HCloud actually is formed. Okay, with 2 big data centers, one in the eastern part and one in the central part, we put all our systems into a virtualized mode, and we are able to automate, virtualize, and even load balance the 2 systems or the 3 systems they want to move forward. So today, the HCloud has been formed. We are building a HCloud. We are actually building the cloud in 2 large data centers. one in the eastern side and one in the central side, geographically separate apart so that we are not actually bound by any of the Greek restrictions. With these two data center relay, we are able to actually move automation to a higher level. Okay, then what are the deliverables to the hospital clusters? Okay, I won't go into very much detail. These are actually, we are actually transforming the cluster data center into a more HCloud data center. And these are the actual achievement or a deliverable that the previous cluster are not able to achieve. For example, infrastructure availability, we're able to push it even further from 99.5 to 99.9, and we can even move our application availability. We can do provision of computing resource in a very quick manner. We actually improve the server utilization. As I already mentioned, when the data center is by itself, you can't actually push the utilization to very much. Most of the time, your server utilization tends to be low. But with cloud automation, you are able to push it beyond 80, beyond 90. And with the higher utilization, you get efficiency, you get economy of scale. That's how the onslaught of cloud computing is all about. We are also able to achieve a more consistent security posture. Previously, when the data center is run by the cluster, every cluster tends to have their own security posture. But moving to cloud, it becomes standardized. We follow the best practices, we use the best practices, and then we make sure the security posture for every system that we deliver to the cluster is consistently achieving the high availability and high standard of quality. We also ensure that there's a proper disaster recovery and backup to be provided by the systems. Okay, we are definitely more efficient. I'll touch a little bit of cost efficiency later. Consistent service level. We are also able to do a very much predictable budgeting process for the cluster. Previously, when they do budgeting, they tend to be very abrupt because there are too much cost to be involved. But with cloud computing, one cost, you can actually cover all the facilities in the cloud computing. So these are the actual advantages and for us to convince the cluster to more or less downscale the data center in today in the hospital and then move it to the cloud. These are the services and good things that we are going to deliver to them. Okay, a little touch about how are we able to convince the cluster who actually owns the data center at the point in time to move to HCloud. Because as we all know, that is very human, because when you own the data center, it is very hard for you to actually surrender the data center to a central body and let the central body run. Unless you convince them by doing a central consolidation, you have achieved cost saving. Right? That's how actually the cost saving has been done. The cost saving part is actually done by a consulting firm that we engage. He's actually engaged a cost consulting firm to help us to actually do the cost modeling. And the cost modeling they did was, they took all the funding that is available and took all the costs, and at the same time there is a predictable demand of the HCloud. How much demand is from the cluster, and from the demand from all these parameters, they work out a price model for us to use. And obviously this price model must be presented to the cluster, and the cluster accept it. We will actually proceed to the implementation stage. This is exactly how we actually do the cost modeling. We look at the total cost and then look at the demand. From the cost and the demand perspective, we derive the price catalog for the cluster to know how much are they going to pay when they actually subscribe to the cloud. So this is the model that we do. This is what I actually explained. All in all, there were about 301 mil over the 10 years period, and we actually do it over the 10 years period. This is actually a very complicated cost model that we do. You can see that they have actually used a very granular model. They actually predicted what the setup cost, the setup cost for the consolidation over 10 years, and then they actually do a cost modeling, and then finally they work out a price model. Right? That is actually done by the public consulting firm for us to actually convince the cluster that this is a price model to go. Okay? And this is the catalog that we come up with. We will sell a package by small, medium, and large of this configuration. Small is of certain configuration, medium, and large. We also sell the database farm. We also have database hosting. At the same time, we also do some co-location, because we understand that today some of the cluster infrastructure or some of the cluster application cannot be virtualized. For example, the Unixes. They will then do a co-location into the HCloud, and then at the same time we provide some costing to them. Okay, these are the add-on costs that we talk about. We also understand that in today, not all the system can fit into the small, medium, large. There is something called, we call the a la carte or the add-on. These are the add-on costs that we have actually computed and also give it to a cluster for them to subscribe. Okay, this is the subscription type, as I already mentioned. A cluster can subscribe by buying small, medium, large. It's very much like those web services and so on. They can also provide hosting. We also provide hosting, and the cluster can bring the databases or your SQL server into the database farm for them to do it. And then obviously we have some add-on costs here. Interesting to note is for those that is being virtualized, they are all owned, the assets are all owned by IHIS. That means to say that IHIS will buy all the hardware and then we'll charge them for a service. For those servers that actually they cannot be virtualized, which actually the institution will still own it, but they will move it into the HCloud. Okay, that will continue to be owned by the cluster. So we have a mixed environment for HCloud. Okay, this is exactly what we actually meant by there will be saving if all the clusters will come together. The top line over here, the top line over there represents if the next 10 years, if nothing is being done, if the hospital continue to run the data center in their own way, that means to say that every hospital run their own data center, run their own operation, the next 10-year cost is likely to be on this part. Now, the next 10 years, if all of them consolidated and bring in all their virtualization together, the next 10-year cost will be this part. So obviously, there's a saving in the gap. And that's exactly how we actually explain to the cluster by putting all your data center together, by having a very robust virtualization program, and by having all the servers together and achieve higher utilization, there will be saving. And that is a very powerful message to all the cluster. Without the saving, the cluster will still continue to run the operations. But with the consolidation, if they are able to achieve saving, the cluster is willing to actually bring in their server and actually buy services from the HCloud rather than actually building their own capabilities. I think that is a slide that actually we went to the cluster, we sell to the cluster, we explained to all the CEOs and financial officers that that is the way to go for the next 10 years. Because having said that, running a data center for the next 10 years will actually impede the cost very, very high. If you continue to run that, then there's obviously a very huge cost impact to the cluster. That is actually the slide, and that is also the point that we all tell all of us from IHIS perspective, goes to the hospital environment to explain what HCloud is all about. Being actually running the hospital, they won't understand the technicality of HCloud and so on. But explaining the cost efficiency, they are able to actually let us actually move towards into this project. And with all the cluster agreed that HCloud is the way to go, we actually embark onto the project of HCloud. And today we are pleased to say that we are almost there. This is the timeline. We are already here. We have actually built the data center. We are building a cloud. Now is the migration process. We have actually started the phase 1 and the phase 2. All in all, there are 12 phases for all the clusters to move their applications into the HCloud. We are today at the phase 2 of the migration. Right? We are around here. By next year, January or February, the HCloud will be fully operational. Today is actually a soft launch for October is a soft launch of some application. Some form of application are already actually residing in the HCloud, but these applications are of a very small scale. Come January, it will be operational. Everybody will be running from there. And the next 2 years, the whole of the healthcare cluster will move to the cloud. And cloud will be the only platform for the hospital to run the application on it. Okay, I think that's actually summarized my whole explanation of HCloud. I will then leave it to the audience here if there's some questions for me.